Over time, Jose noticed himself gaining weight, likely due to stress and an unhealthy lifestyle. His wife, Juana, noticed his occasional difficulty breathing, which concerned her. Wanting to ensure his well-being, she scheduled a doctor's appointment. On the day of the appointment, they entered the waiting room together. Jose appeared nervous, fidgeting with his hands while seeking comfort from Juana's supportive grip on his arm. When their names were called, they entered Dr. Smith's office. Dr. Smith warmly greeted them and invited them to take a seat. "Mrs. Juana, you've brought your husband in for an appointment today. What seems to be the issue?"
Well, Dr. Smith, I've noticed a pattern over the years. My husband has been struggling with his breathing, especially as he continues to gain weight. It's particularly noticeable at night when he's asleep. He often wakes up gasping for air, and it's been going on for a while now. He's not one to voluntarily go to the hospital, so I had to book this appointment and persuade him to come. I'm genuinely worried about his health and overall well-being.
You've done well, Mrs. Juana. Mr. Jose, can you describe how you've been feeling lately?
Of course, doctor. As my wife mentioned, I struggle to breathe, especially at night. It often feels like I'm breathing through a straw. Sometimes my breath stops suddenly, almost as if I'm about to suffocate, and then I catch it again. It's like something is blocking my airways, and it really disturbs my sleep.
Based on your descriptions, it sounds like you might be experiencing sleep apnea.
Sleep apnea? What does that even mean?
Sleep apnea is a sleep disorder where breathing repeatedly stops and starts during sleep. It happens when the muscles in the throat relax too much, blocking the airway temporarily. This can lead to pauses in breathing or shallow breaths, which can happen multiple times throughout the night. Obstructive sleep apnea, or OSA, is the most common type of sleep disorder, affecting an estimated 15% to 30% of men and 10% to 15% of women.
Wow, that sounds serious. But what causes sleep apnea?
There are various factors, but obstructive sleep apnea often happens when throat muscles relax too much during sleep. Factors like excess weight gain or obesity, age, smoking, nasal congestion, and even sleeping positions can contribute to it. In fact, observational research shows that obstructive sleep apnea increases the risk of sudden death, especially in men, if proper care is not taken. The National Commission on Sleep Disorders Research also reports that about 38,000 deaths occur annually due to cardiovascular issues connected to sleep apnea in some way.
OMG, I don't want to die. What can I do about this, doctor? Could my weight gain be causing this condition?
Yes, indeed, Mr. Jose. Weight gain is a major factor in sleep apnea. It can add extra tissue around the airway, increasing the likelihood of it collapsing during sleep, hence the breathing difficulties.
Is there anything we can do about it naturally?
Of course, since your case seems mild, losing weight can significantly improve your symptoms. However, for more severe cases, other treatments like an oral appliance or continuous positive airway pressure, also known as CPAP therapy, might be necessary. But I can share with you both the 7 ways to manage or cure sleep apnea if you don't mind.
That would be perfect, doctor.
Please proceed. We're all ears.
Like I mentioned earlier, carrying excess weight, especially around your neck and throat, can affect your breathing, particularly during sleep. This extra weight can contribute to airway obstruction. However, losing weight can help reduce fat deposits in these areas, potentially decreasing the risk of airway collapse and breathing pauses as you sleep.
I do want to lose weight, doc, but starting feels overwhelming, you know? It's difficult.
I understand, Mr. Jose. Taking that first step can be tough, but it's all about commitment. Once you're committed, you'll find it gets easier. Plus, losing weight has some amazing benefits for your breathing and overall health. And let's not forget about abdominal fat. It can put pressure on your diaphragm, which is important for breathing. This pressure makes it harder for your lungs to expand fully, especially when you're asleep.
Oh, so that explains why I've been feeling so tired lately.
Exactly. But the good news is, by shedding those extra pounds, you can relieve that pressure on your diaphragm, making it easier for you to breathe and sleep better.
I think it's time I make some changes. Maybe I'll start hitting the gym.
That's a proactive step. Regular exercise can indeed make a big difference. It helps burn calories and build muscle mass, which can aid in weight loss, especially when combined with a balanced diet.
Exactly. I'll make sure Jose sticks to his exercise routine once he starts.
That's great to hear. Once Mr. Jose starts exercising regularly, he'll reap the benefits of having a clear airway. Exercise helps with sleep apnea by strengthening throat muscles and decreasing the risk of windpipe blockage during sleep.
I'm definitely motivated to start exercising now. Do you have any tips on which exercises I should focus on?
For someone with sleep apnea, aerobic exercises like jogging, brisk walking, cycling, or swimming are excellent choices. They can improve your breathing during both wakefulness and sleep.
Got it, I'll make sure to include those in my routine. It's time to renew my gym membership and get started on this journey to better health.
Exactly. With consistent exercise, you'll notice positive changes. Now, let's discuss sleep positions. How do you typically position yourself when you sleep, Mr. Jose?
Well, I usually prefer lying on my stomach. It feels comfortable to me.
Although it may feel comfortable for you, sleeping on your stomach is not ideal for managing sleep apnea. It can put pressure on your chest and abdomen, making it harder for your lungs to expand fully.
Really? I also enjoy sleeping on my stomach sometimes.
It's a common position, but for people with sleep apnea, side sleeping is often recommended. Sleeping on your left side, in particular, can help prevent the tongue and soft tissues in your throat from breaking down and hindering your respiratory tract during sleep.
That's good to know. What about sleeping on my back?
While it may seem like a neutral position, sleeping on your back can equally increase the risk of airway obstruction in sleep apnea patients. With this position, gravity pulls your tongue and soft tissues backward, narrowing your airway and potentially causing more breathing pauses.
Wow, I never realized sleeping position could make such a difference.
Yes, it can. It's also helpful to elevate the head of your bed slightly before sleeping. This can prevent your tongue from falling back, ultimately improving airflow and reducing the severity of sleep apnea.
Thanks for the insight, Dr. Smith. I'll definitely be more mindful of my sleeping position from now on.
Count me in too. I'm ready to make some changes for better sleep and health.
It's important to address smoking too when discussing sleep apnea. Do you smoke, Mr. Jose?
Yes, I do. Especially when I'm stressed. But I'm trying to quit, for my wife's sake.
Yes, Doc. I've been urging him to quit smoking for a while now. I hope he makes a lasting change this time.
That's commendable. Quitting smoking is important for preventing sleep apnea. Smoking irritates the throat and increases inflammation, making the airway more prone to collapsing during sleep. By quitting, you allow your airway to heal, reducing inflammation and improving airflow, which can alleviate sleep apnea symptoms.
I've heard that cigars are healthier than cigarettes, so I tend to opt for those instead.
Oh, please. Don't even think about it.
Mr. Jose, it's crucial to understand that there's no such thing as a healthy form of smoking. Whether it's cigars, cigarettes, or any other tobacco product, inhaling smoke into your lungs can have serious consequences for your respiratory health. Smoking is linked to a higher risk of cardiovascular diseases, including hypertension, so totally quitting smoking is the best way to protect your health.
I see. I'll do my best to stop the habit for good.
That's a fantastic commitment. Quitting smoking can greatly enhance your health and well-being. Instead of relying on smoking for stress relief, consider healthier alternatives like meditation, exercise, or engaging in healthy activities you enjoy during your leisure time. These can all help manage stress more healthily.
Thank you, Dr. Smith. I'll take your advice to heart.
It's always a pleasure to offer guidance. When it comes to managing sleep apnea, it's also important to avoid alcohol, especially in the hours leading up to bedtime.
My husband isn't much of a drinker. He's a lightweight, really. But we do enjoy a glass of wine after dinner sometimes. Is that problematic?
Interestingly, even occasional alcohol consumption can affect sleep apnea. Alcohol has a tendency to relax muscles, including those in the throat. During sleep, when these muscles excessively loosen, it can result in blockage of the air passage, causing interruptions in breathing patterns.
Well, that's eye-opening. We usually have a glass after dinner to help us wind down and get to sleep faster.
Alcohol can initially make you feel drowsy and aid in falling asleep. It also disrupts the sleep cycle, preventing you from reaching deeper stages of restorative sleep. This disruption can worsen sleep apnea symptoms and lead to daytime fatigue and irritability.
Oh, that explains why we wake up feeling tired and cranky after those wine nights.
Exactly. Instead of relying on alcohol, consider adopting healthy sleep habits. maintain a consistent sleep schedule, indulge in a relaxing bedtime routine, and optimize your sleep environment with comfortable bedding and a serene, dark room. These practices will promote better and faster sleep without the negative effects of alcohol.
Looks like we need to rethink our evening routine. How about swapping out the wine? Maybe try something different.
Fruits, nice herbal teas, or non-alcoholic wines could be a refreshing change, don't you think?
It sounds like you're in for a cozy night ahead, but make sure you consume those fruits and beverages in moderation, especially at night. And while you're out shopping for new beverages, you should consider picking up a humidifier too. It could make a big difference when it comes to sleep quality.
Honestly, I've been wanting to buy one, but it always slips my mind. Do you think it could help with my husband's sleep apnea?
Absolutely. Dry air can worsen nasal congestion, causing discomfort and increased snoring. A humidifier adds moisture to the air, making breathing easier and more comfortable.
That sounds like exactly what we need. Our bedroom can get pretty stuffy, especially during the summer, even with the ceiling fan on.
And it'll be useful to have one in the second bedroom for when the grandkids visit.
Definitely.
I'm glad you're considering it. However, proper humidifier care is highly important. Make sure to clean it regularly to prevent mold and bacteria buildup, and using distilled water instead of tap water can help keep the air clean and pure.
We'll endeavor to do that. Thanks for the tip, doctor. You really know your stuff.
You're welcome. Now let's explore the last step in naturally treating sleep apnea: throat exercises. These exercises are a great non-invasive way to address sleep apnea, particularly obstructive sleep apnea, or OSA.
Okay, so how exactly do throat exercises help?
Throat exercises target the muscles of the upper airway, like the tongue, soft palate, and throat walls. By strengthening these muscles, throat exercises can work wonders in preventing the breakdown and obstruction of the airway while sleeping.
Are these exercises like regular workouts, and how do we do them?
Yes, throat exercises involve different techniques such as tongue exercises, palate exercises, and throat stretching exercises. For example, tongue exercises include tongue stretches, where you stick your tongue out as far as possible and hold for 5 to 10 seconds. Another one is the tongue press, where you press the tip of your tongue against the roof of your mouth for 5 to 10 seconds. Repeat these movements 5 to 10 times for optimal results.
I'll definitely give those a try.
Excellent. By including these natural remedies in your daily routine, I can assure you that sleep apnea will become a thing of the past. Poof, gone.
Doctor, thank you so much for your guidance. You've been incredibly helpful. I'll do everything I can to support Jose and ensure his well-being.
Yes, thank you, doctor. I truly appreciate your advice. I'm committed to following through with everything you've outlined today.
The pleasure is all mine. But remember, if you don't see any improvements, or if you experience any new symptoms, don't hesitate to come back to the hospital. Sleep apnea can manifest in various ways, like loud snoring, frequent urination at night, or even morning headaches and mood swings. So keep an eye out for any changes, and let me know if you need further assistance. Jose and Juana expressed their heartfelt gratitude to Dr. Smith once more before leaving his office, promising to diligently implement all the remedies discussed. 6 months later, they scheduled a follow-up appointment with Dr. Smith. To his surprise, Jose had shed all the excess weight over the months and appeared significantly improved and healthier. Oh my goodness, I can hardly believe my eyes. It seems like those excess calories vanished from your body overnight. Wasn't it just 6 months ago when both of you were here? It feels like yesterday.
All the credit goes to my wonderful wife here, her support, my determination, and of course your guidance, doctor. I feel incredibly better after shedding all that weight. I sleep like a baby now, thank you so much.
And on top of that, his mood has improved drastically. He's not as irritable as before. His sleep has improved, and he no longer experiences those frightening moments of breathlessness during sleep. We owe it all to you, doctor.
I'm delighted to hear that. I only provided guidance. Your dedication and efforts brought about this wonderful outcome. It's fantastic that you both sought medical help early. Untreated sleep apnea can significantly affect life expectancy, reducing it by 8 to 18 years. so regular checkups are important whenever you notice anything unusual in your health.
Duly noted. We're super grateful, Doctor.
I couldn't have done it without you, honey.
Love is truly in the air. Just a reminder, if you know anyone experiencing symptoms of sleep apnea, encourage them to seek medical attention immediately. Diagnosis typically involves a sleep study, either at a center or with portable devices at home. In Mr. Jose's case, his condition was mild, so a sleep study wasn't necessary.
Thank you again, Doctor. We truly appreciate everything.
Dr. Smith decides to conduct a thorough checkup on Jose before they leave to ensure he's in stable health. Thank you for watching. If you liked this video, please subscribe and watch more videos here next.